Welcome back to the Health 210 podcast. Today we've got a physician who's only 35 years old but has been practicing radiology for close to 30 years. That's how he introduced himself to me. Dr. John Hogg with the Medical Bean Clinic. Welcome and thanks for taking out the time to be here.
Thank you. Appreciate it. Great to be here.
So I understand that you're a radiologist, but now you have a Medical Bean Clinic, so you specialized in vascular. Tell me a little bit about that.
Well, I was in radiology, love that, and I was practicing in Austin. And one time I went into the head administrator's office, and she said, "Dr. Hogg, do you mind if I ask you a personal question?" I looked around, no one was there. I said, "No, please." So she walks around the desk, and she leans on that, and she pulls up her silk pants leg, very beautiful lady, and she says, "I have this ulcer here on my leg." And she has this thing like an avocado.
Oh, boy.
It's crazy. And she says, "I'm going to bariatric treatment, and every week I go put in the oxygen tank 3 times a week. And I've talked to my cardiologist. I've talked to my internal medicine doctor. And of course, she has every doctor there at her beck and call. Mm-hmm. So she has the best of doctors looking after her. And she says, it's not getting any better. And I keep telling her, I think it has something to do with this varicose vein. And she shows me one the size of her thumb bulging out. I thought, here I know this is a venous stasis ulcer, and yet she has the very best. She's the head of all these hospitals. She has the best of medical care, all these doctors, and they're not really diagnosing it. So it's kind of like the light really came on. I felt like it was my calling, that here the lady has the best of care, and they're just not recognizing this is venous stasis ulcer. Yeah. It's caused by the bad veins.
Wow. And this is how far along in your career as a radiologist?
I had practiced for a number of years, okay. and in the first part of the 30 years.
Yeah, absolutely.
Yeah, but I just thought, this is something that's underdiagnosed, that's so impactful.
Yeah.
Your legs are your transportation.
Oh, yeah,
you don't want a flat tire, and
you
got to keep them going. Yeah. So I decided that's what I wanted to do.